Hello, my name is Dr. Finian Fallon. I'm a psychologist and psychotherapist here in Dublin, Ireland. This is one of a series of videos designed to help healthcare professionals and frontline workers during the coronavirus pandemic. A lot of research and discussion and clinical experience has gone into the production of these videos. Hopefully some of the content can help you. Firstly, on a personal level, it's important to remember that we all make mistakes, and that's okay. We are doing our best at these difficult times, and what we do is good enough. It's not about fault, but it is our responsibility to mind ourselves, to take care of ourselves, to work, albeit imperfectly, as best we can, and to remember that we are human, and to be human is to make mistakes. So to start with, I'm going to try and help you orient to what is happening. There are no great textbooks for directing what we do at the moment. We have to fall back on our professionalism and experience in many cases, or rely on other people who are better experienced than we are. But as human beings, we need clarity and structure, and there's a lot of uncertainty around. So this graphic from Dr. Saying on Twitter might help to place what's happening and what is ahead in this context. If we look at the graph, we see in the first wave of the virus, we see the immediate mortality and the shock of rapidly deteriorating patients. This is really unprecedented in the experience of many professionals, even seasoned professionals. Difficult decisions will have to be made, and this is an essential, yes, an awful, but an essential part of what must be for the moment. For the moment, all you have to do is your job, and try not to spend too much time living in guilt about what the world is throwing at you at the moment. At this stage, I've noticed the heroization of a lot of our workers, which is fair enough on some level. They can be seen as heroes, but it can also put people under a lot of pressure, and a lot of people don't feel like heroes when they're going to work, and may be scared or even terrified, and that's normal as well. So again, just to try and do your job as best you can. This intense period will pass, but we should be oriented towards intensity for the next few months. This will pass, as I say, but it's going to be very real for many of you for some period of time. I expect that resourcing and operational issues will get better, hopefully, as time goes by, so we must remember this also. All of the waves on the graph overlap, and in the second wave we see the impact of restrictions on non-COVID conditions. We've already seen in Ireland a fall off in attendance at A&E, and we might experience a resurgence of that, or the impact of that, as people become more confident, and hopefully restrictions will be removed over time. Again, this is temporary, but be prepared for a period of seesawing here in relation to the ups and downs of resource demands, but also personal and emotional demands on you as frontline workers as well. Related to this is the impact of the pandemic on chronic health conditions, people accessing care again that for routine contacts previously that haven't taken place in a while. This again will have an impact on resources and on you, and it may peak again after the virus has been brought under control. But think again how this might impact you and your work, and remember the seesawing impact that people are often experiencing. Related to this is the impact of Dr. Tang when he talks about in the aftermath, in the fourth wave, the psychological trauma that may recur for many workers. Generally, workers in pandemic situations and crisis situations tend to experience higher levels of post-traumatic stress and disorder, so-called, as a result of these kind of experiences. Those who spend time in quarantine, including health workers, may be more likely to experience this along with guilt and anxiety. So again, be prepared. Thankfully, most of us are resilient in the face of trauma, and most of us will recover in a reasonable amount of time. There are economic concerns as well for many professionals who may have second jobs, or who are just worrying about the outgoings at the moment, including childcare, which we'll talk about later. But in those cases, do seek help from other people and from family and friends and colleagues where necessary, and try not to worry about things that are outside your immediate concern in terms of finances and that kind of thing. In terms of your basic supplies, make sure you get them placed. Try and sort of pick up a routine around that. Get some help with that if you need it. Acknowledge anxieties around this as well. Try and prepare food from fresh if you can, or get someone to help you even better if you can. It can help with maintaining good relationships and reaching out with other people. Sugar and processed foods might not be the ideal thing for managing your moods, and alcohol is part of that question as well, or that concern as well, in the context of rapidly changing external context. So mind yourself with those as well. Finally, connect. Reach out for help. Seek out assistance for help from friends or available services. Good outcomes from these kind of situations tend to be associated with situations where people have good networks around them. So make efforts in that regard. So that's really a brief orientation to this process and what might happen over the next few months. I'll talk about in other videos around issues related to parenting, finances, perhaps the impact of quarantine, boredom, relationship challenges, and other issues including stress, anxiety, and depression and sleep. Thanks to my colleagues Catherine Butterly and Lauren Damon-Johns for their input into this video. Mind yourselves, this will pass, and never give up. Thank you.